What's up, guys? Jimmy here in Suburban Survivalist. What we're going to be doing today is a video on my updated medical trauma first aid kit, whatever you want to call it. Okay, so I made a big upgrade. Oh, again, sorry about I haven't posted in a pretty long time. Sorry about what you see here. I did my best to place a like tactical cloth or whatever they call it, shemag or shemay or whatever. I tried to put that on the floor to make it look cool or whatever, but you can still see the carpet. I'm sorry about that, and you really can't see me. Again, sorry about that. But I made a big upgrade from the old bag that was in it, that my medical kit was in. This is now actually a backpack. So if I bug out, I could be like, say there's an extra person that wants to come, like a refugee or something like that. I'm always going to have more gear for them to carry. So I'll be like, I'll keep you alive if you carry this and come with us. Now, again, I would probably only do that with trusted neighbors, friends, family, stuff like that. But it's a good option to have, even though it's not a complete necessity because you hope you're never going to need it, but you absolutely should have it. Anyway, so my kit has evolved a lot from me getting more and more experience in the field, actually treating patients and stuff like that, and the more training I get and things like that, and also the more funds and gear that I get. I can put more money into stuff, but let's get started. So to start out on the exterior, I have a green Sharpie, a black Sharpie, and a red Sharpie, and a pen light. You can check eyes with this. It's also actually a pen, which is nice to have. Okay, then I have another light that is a little finicky, but that's like a secondary light. Then I have a Olight i3E EOS light for $12 and one AAA battery. It is a very small, very bright flashlight. This is awesome to have. Okay. Then I have a first aid emblem to let people know that I have medical training and that this bag is a medical kit. Then on the other side, I just have a blue Sharpie. There wasn't any space for it on the other side. And then two pairs of trauma shears, EMT shears. EMT shears that are just held on by a rubber band. Again, you could get like shear holders and stuff like that, but that is expensive, and I'd rather actually have the gear than have the tactical looking pouch. So we'll just start off in this top pocket. Oh yeah, so this kit is not like a blowout kit that you would carry like if you were going into combat or just a day at the range or something like that. This is designed to be a multiple person everything. So I bring this to the cabin when me and my friend are working with things like this. This is a Snow and Neely axe. Just wanted to give all you axe lovers some eye candy. But when we're working with things like this, where we could easily open our femoral artery and then bleed to death if we don't get proper treatment. So this is designed to treat everything. So like ticks, bug bites, little things like that. I have as much medication as I could get in the bag, as well as it's also like a blowout kit, like in another first aid kit. So it's designed to everything from trauma to cuts and scrapes, basically. Okay, so cortisone, this goes in a different place. This goes in, sorry, something just fell back there. This goes in a different place, but I just forgot to put it back there. So just some cortisone cream. It is a anti-itch cream. It's just hydrocortisone cream. It's anti-itch, good for bug bites, chafing, stuff like that, rashes. You can even use it on like poison ivy, stuff like that. It's just really good. I'm going to try to speed through this as much as I can, not ramble. 1 pair of exam gloves. This came in a smaller first aid kit, but, I just put it in here. Then nitrile gloves, a wet wipe, just a spare one, and then 2 lighters because why not? Okay, fire is good. And you might have to cauterize some wounds. Just kidding, don't cauterize wounds, that's a bad idea. Then, this I'm not going to go into just because it's a bunch of just really small stuff. But this is basically just cuts, scrapes. There's tweezers, Neosporin, Band-Aids, a few wipes, moleskin, butterflies, steri strips. This is honestly the most this is really like the only compartment that I ever open and that I ever hope I ever have to open, just for small stuff. Like my cousin fell off his bike, I patched him up. Blisters, stuff like that. I treated a ton of blisters this past weekend that kept reopening, stuff like that, because this girl was walking in sandals all over an amusement park. Then this is like my antibacterial disinfecting section. Okay, so a bunch of different hand wipes, alcohol pads, a little bit of aloe lotion. Like me and my friend, we were working all day and our hands were kind of chopped up, dry, cracked, from working all day with hand tools and stuff. So a little bit of this aloe lotion and our hands were back to all good. Some spray hand sanitizer and a small bottle of hydrogen peroxide. Then this is like the little bit bigger bandaging section. So this would be like a pretty serious cut, like say on your arm or right on your hand. You could bandage in between the hand, or a cut that covers a big area. Like say I get road rash and it's all the way up here from like me falling off my bike or something. Then you could wrap this all the way up. So it's 4, 5 different roll gauze and 2 3x3 gauze pads, which are not very large, but they're pretty big. With these smaller compartments, I'm not going to go all the way into it. When I get to the bigger stuff, I'll pull everything out for you. Then a roll of waterproof tape. The tape and the gauze pad I use all the time. Like for that blister, a normal Band-Aid, like one time a blister started to open up and bleed a lot, a normal Band-Aid would have bled right off in a second. My mom also just got a biopsy for a surgery or whatever that she's having, and one of the things bled a little bit. So being able to make like your own bandage instead of just using like a normal Band-Aid or like a store-bought one, like being able to tape on a gauze pad gives you more absorption and stuff like that. Then here I have 2 chem lights, a green and a red. Two main purposes for this. Again, it can be multi-use, but on the road you can set it out. Like if you're treating a automobile accident at night, you can put this out so people don't drive into you. Also to signal emergency services, or something like if you crack it and then give it to a child, then like, hey, if you let me treat you, if you let me bandage your wound or whatever, I will give you this. And that might, where otherwise they would be scared or something like that, this could distract them, and it's just good to have. Or if it's late at night and you need to light up your wound or whatever. Then I have 2 ACE bandages. I usually have 2 more, but they're both in use right now. My dad messed up his knee pretty good because he was working a lot on his knees at our cabin, and I had to bandage him up with the ACE bandage on his knees to hold some ice on. basically like a military triangular bandage. There's 1,000 uses to these. I'm not even going to go into it, but very multi-purpose. A pair of hemostats. So much you can do with this. Invaluable to have. Then, like an alcohol pad and a little notepad, which the notepad can be used for just writing things down about your patient if they have something wrong with them. There's an alcohol pad here, then a assortment of a few antiseptic wipes, and then non-aspirin, extra strength non-aspirin, aspirin. I think I have some ibuprofen in here too. Just so a few, basic meds. This is some paracord. This is like the sprains and strains compartment, basically. Another triangular bandage, 2 more ace bandages, a roll of like sports tape, a roll of like medical tape, some paracord, a roll of electrical tape, and then some Coband. Ton of uses for that stuff. A bottle of sterile saline wound wash solution. It basically, peroxide has its uses, but peroxide, if you don't know, it kills the bacteria, but it also kills the cells, the good cells that are like helping your body. So having some saline is good too. And also this is under pressure, so you can like spray dirt and debris out of the wound. Normal clean water will work as well. Some Benadryl. One of my cousins has an allergy, used to have an allergy to milk, and now has an allergy to peanuts, where he can go into anaphylactic shock if he consumes peanuts or comes in contact with peanuts. And having Benadryl will at least help, especially if it's very little, because I'm not a doctor and I can't get a prescription for an EpiPen. So this is the best I can do. Also, bug bites is good. It's a antihistamine. I forgot the name of it. It's an antihistamine. So basically that just helps with allergic reactions. Then 2 like foil blankets. If the patient is going into shock or has hypothermia, this is a great way to warm them up, try to keep their heat in, also keep the rain off someone. Good to have. That's it for that pocket. Now we're getting into the big pocket. And what I really like this bag for medical bag is that it clamshells all the way open. So this is like my trauma portion of it. So then in here I have 2 big like Curlex rolls, a 4x4 and I believe a 5x9, or maybe 2 4x4s, something like that. I had to use a 4x4 at camp, or maybe a bigger gauze pad, I forget. While I was at Boy Scout camp, one of my friends was fooling around with their knife, cut themselves pretty good, and we elevated it. The bleeding stopped pretty quick, put some pressure on it. Anyway, a roll of duct tape. I'm not saying anything about duct tape. It's duct tape, bro. A roll of TheraBand. This can be used as a improvised tourniquet as well as an improvised compression bandage. Then I have a Israeli combat compression bandage. Then this is a Quick Clot trauma pack. It has a 25-gram package of Quick Clot, a trauma pad, nitrile gloves, duct tape, triangular bandage, 4x4, 2x2, roll gauze, antiseptic wipe, and the bag, which can be used for sucking chest wounds. Then in here is a instant cold pack, but I put in a hard container so it doesn't get activated by accident. Then in this, I have a sheet of plastic. This was from a Ziploc bag, but this is pretty sturdy plastic. this is pretty sturdy plastic, which I can't afford, like a Hyphen chest seal or a Halo chest seal, I think it is, or a Fox chest seal or whatever. I can't afford those. They're expensive. So this is the next best thing. A little bit of duct tape. You tape this on over a penetrating trauma to the chest cavity. You tape that over there, and then it makes an occlusive dressing, which makes sure make sure no air gets into the chest cavity, so you don't create a tension pneumothorax or a hemopneumothorax. Wait, no, it wouldn't prevent a hemopneumothorax, actually. Only a tension pneumothorax. No, wait, it's tension pneumothorax and tension hemothorax. Yeah, okay, I might be mixing up some words. Don't quote me on any of this terminology. Then some quick clot gauze, quick clot clotting gauze, impregnated with kaolin. A cat tourniquet, which is in this mesh pocket so I could see it. Just a cat tourniquet. This is invaluable. A stethoscope. This might be a little frowned upon, but this was the only way I could get a stethoscope. I basically bought it at a flea market for $1, but it still functions. The diaphragm right here is still good. It still works, and I clean the earpieces out with some alcohol, and alcohol and a Q-tip, so that they were clean. You know, if there was residue from someone else's ears, so that I could safely put it in my ears. Then this is just a old military dressing first aid field camouflage, 4 by 7 inches. Red color indicates back of dressing. Just like a normal gauze bandage, basically. It has a little bit of elasticity, I'm probably saying that wrong, in it, so it will create a little bit of a compression bandage. But when you don't need an Israeli, but you need more than like a Band-Aid, this is a good thing to go with. So, hope you enjoyed the video. If you have any suggestions for videos that you think I should make, please comment them. Please like, comment, subscribe. Hope you enjoyed.